choose the public option without, with mandate, but without being able to keep the private insurance that you are already happy with, if that is so, and if you can afford it.
Thank you, Ben. Republicans, what is your rebuttal to that argument?
Well, first of all, the Republican Party believes that the public system is a Trojan horse for a universal, single-payer healthcare system. We simply believe that because we feel that the public option is a stacked deck against private insurance industries. Specifically, when you look at the expenses that need to be, the different expenses between a public option and private insurance. First of all, private insurance needs to keep large reserves in order to pay for large medical bills. Public option, being federally subsidized, doesn't have to do that. All they have to do is raise taxes if they need to pay off large bills. The private insurance industries need to pay off employees. They need to pay for employees' pensions and benefits. And they also have to pay taxes, which the public option doesn't have to account for at all. I'd also like to point out that Arizona and Maine both have had public options before. Arizona's public option within 3 years of its creation was $20 million in debt and had to be bailed out by Arizona taxpayers. Maine's public option, which President Obama feels that his public option will cover most of the people who are uninsured currently, Maine's public option was overflowed by those who previously had private medical insurance and decided to switch to government insurance because it was a lot cheaper. So that drove businesses out of Maine. Also, only 3% of those who were uninsured joined the Maine public option. So it was a failure as to ensuring a large portion of those who didn't have insurance. They didn't get the opportunity because the individuals who had private insurance took those spots up. Also, what I'm trying to get at, as far as the Trojan horse aspect, is that the public option doesn't need to stay in the black, meaning they can go in debt as far down as they want, just like the Postal Service is in debt. FedEx and UPS are not. I'd also like to bring up Amtrak. Amtrak is in debt. Medicare and Medicaid are in debt. Medicare as a whole is $32 trillion in debt. That can't even be bailed out by our entire economy. They've made too many promises, and this is just another broken promise. The government cannot be the referee and a player in the same game. It's not fair to private insurance.